Hello, welcome to this NMC OSCE tutoring video. My name is Hannah. I am an experienced UK nurse of 20 years, a university lecturer of nearly 7 years, and I've been an NMC OSCE programme lead and delivered a really successful programme for the local trust. And I am sharing with you some of my top tips and advice to help you study at home for your NMC OSCE exam. It's also a really difficult exam, lots of content to learn, especially if you are an adult nurse. So I hope you find these videos helpful. And like, subscribe and share them within your groups for friends and family that are studying the OSCE. So today I'm going to look at the clinical skill station of IV flush and VIP score. We'll get started then. So IV flush and VIP score, this is a 12-minute clinical skills station for the adult NMC OSCE. You need to assess and score the cannula using the VIP scoring system. You need to read and confirm the validity of your prescription. Remember, an IV flush is a medication, needs to be prescribed, okay, and all the same checks apply as they do to our other medication clinical skills stations. You then need to flush the cannula using an aseptic non-touch technique, and you also need to leave time to sign your medication administration record. So what equipment will you have? You'll have your pre-filled normal saline. So you won't need to draw this out. This will come in a pre-filled syringe. Chlorhexidine wipes to clean the end of your extension set. And then you'll have your extension set, which will be connected to the cannula. And also you will need PPE for this station, so your gloves and your apron. So scenario and paperwork. So you'll get your scenario, you'll get the VIP scoring chart, so you won't need to remember the VIP scoring. That will be part of your station documentation, and you can get that from the NMC supporting documents big PDF, which you can go off the NMC website. You may have most probably will have a picture of a cannula to do your VIP scoring on, and then obviously you're going to have your medication administration record as well. So it might be just a simple assessment scenario. So you've just been asked to flush the cannula for a patient that's receiving IV antibiotics, and you've been asked to do a VIP and carry out the saline flush using an aseptic non-touch technique. So you could have pictures of cannula. So I've got this cannula on the left here. This I would VIP, the score is 0. There's no redness, no swelling. I'd ask if there was any pain or tenderness. There's no visible or palpable cord. Okay, and then this one on the right here is definitely got a VIP of 1 with some redness there. And if there's pain there, then that would need to come out. So you'll have a cannula picture. You're then going to have your medication administration chart. Most probably be a hospital chart because patient most probably will be in hospital. So again, remember those key bits you need to verbalise. So the date, your drug, your dose, your route, your time that's required, and the prescriber's signature name and bleep, and confirming that prescription is clear, valid and legible. And then you're going to have your VIP score. Okay, so you'll have this. So like I said, if the IV site appears healthy, it's a VIP score of 0. You can carry on and use that cannula. If there is pain or redness, then the VIP score is 1. Okay, so but if you have pain and redness together, then the VIP score is 2. Okay, and that then cannula needs to be recited and taken out. Okay, so it needs to be removed and need a new cannula put in. And again, a VIP score is 3 is pain along the path of the cannula, redness and swelling around the site. And 4 is pain, redness, swelling, and a palpable venous cord. And 5 is all of those things plus a pyrexia. And I've put a big arrow next to this here because when you are verbalising and assessing your cannula, these are the key things you need to verbalise and do. So if you forget, just go to your VIP score and look right at the very bottom. And these are all the things you need to verbalise when you're assessing that cannula. So assessing if there's any pain along the path, if there's any redness, swelling, palpable venous cord, and if the patient has a pyrexia. So station breakdown. So I would personally do this in this order. Again, you might have learnt it in a different order, which is absolutely fine as long as you're safe, okay? But I would always do my key principles. You must do your ID checks and allergy checks because of the medication, and you must get your patient consent. I would then personally read my prescription and confirm it's clear, valid and legible, and know exactly what flush I need to get out. And then I would go and get all my equipment. It seems like a logical way to go about the skill. And again, going to be collecting and checking that equipment, make sure it is all sterile because we're doing an aseptic non-touch technique, and verbalising that saline flush matches my prescription. I then come back and assess and verbalise the VIP score of the cannula, and then I'm going to go on to administering the saline flush using that aseptic non-touch technique, disposing of my waste, doing my documentation on the medication administration chart, and checking the patient is comfortable and just ending that station professionally. So key principles, as with all our clinical skills, you most probably know these by now, but safety, privacy and dignity, and decontaminating the hands using the World Health Organization, introducing ourselves using hello, my name is, and then getting the patient to confirm their name, date of birth and hospital number. And they're going to do that verbally, and you're going to check that against the wristband and your medication record. And then you're going to ask the patient if they've got any allergies and check this against the red wristband and the medication chart. ID check's really important. Saline flush is a prescribed medication. Explain the procedure and gain consent from the patient. So explain that you've come here to assess the cannula, but also to give a flush. And you want to know if they've got any pain or discomfort, and just make sure they are comfortable before you proceed. Then I'm going to read the prescriptions, so exactly the same with all our medication administration stations and clinical skills. We're going to read the front page, all the patient details, prescriber's details, and then we're going to find the part of our prescription with our saline flush. Might be a once only, might be an as required on the back, and might be a single prescription sheet as well. But no matter what your prescription chart looks like, you are looking for that same information all the time. So the date, and reading the date, really important, which is today, the drug, the dose, the route, the time, prescriber's name, signature and date, and confirming that prescription is clear, valid and legible. Make sure all your patient details and allergies match what you have checked at the beginning as well. Then I'm going to collect my equipment. So you can just state that your trolley's been cleaned with detergent wipes. That is the marking criteria. And similar to your ANTT, you're going to put all your equipment on the bottom shelf. So you're going to get your saline flush. You want to read this and check this against your prescription chart, including the expiry date, okay, and the volume. And as it's an IV medication, you can ask the examiner to double check this for you, okay, because we would double check all IV medications in practice, even though it is a saline flush, okay. Verbalise that it is intact and sterile and sterility markers in place. You also need a chlorhexidine wipe, and you'll need your PPE, your apron and your gloves. And we're going to assess our VIP score. Okay, so your VIP score is your visual infusion phlebitis score, and you need to verbalise whether you can see any signs of phlebitis. And like I said, the key things to verbalise are on that VIP score at the bottom. So you're going to verbalise and ask the patient if there's any pain along the path or around the cannula. You're going to verbalise if you can see any redness around the site, any swelling, if there's a palpable venous cord, and if the patient has got a pyrexia. Once you've done all that, you then need to decide if your cannula is a 0 or 1, in which case you would go verbalise that and go ahead and use the cannula. Or if it's a 2 or above, then that cannula needs to be taken out. Then we're going to administer our saline flush. So decontaminate your hands. Remember, this is a non-touch technique. Put on your gloves and your apron. Part open your saline flush, just leaving the packaging part open like this, that make it easier for you. Take your chlorhexidine wipe, and you're going to dry the end of your needle-free cap for 30 seconds and allow that to dry for 30 seconds. Once you've done the cleaning, keep hold of the needle-free cap. Don't put that down on the patient because you're going to decontaminate again. That is a fail. So keep hold of it. Then you are going to get your flush, and it's like a twist. I'm going to twist and push that onto the end of your needle-free cap, okay? And then you are making sure you're not contaminating the key parts, so the end of your syringe or the end of your cap, because you've just cleaned that. You want to unclamp the line, okay? So you want to unclamp it once you put the syringe on. That's important. Otherwise, you'll get a load of backwash. And you're going to flush the cannula using a pulsating action, or sometimes referred to that as a push-pause action, okay? Once you have done that, you are going to put your clamp back on before you remove the syringe, okay? If you don't put your clamp back on, you're going to get a load of blood, which will backwash through your cannula. Whilst you are flushing that cannula, you are assessing the patient to making sure they are not experiencing any pain or discomfort. whilst you are doing that. Then you're going to dispose of all your waste into the clinical waste, and you're going to remove your gloves and your apron and put that all into the clinical waste as well. Decontaminate your hands. Again, you've removed your gloves, so you should be decontaminating your hands at this point. And then you need to do your documentation. So again, depending on your medication chart, make sure you put your signature, the time. You may need to put the date as well. It depends what type of prescription chart you have. And if you've got a hospital prescription chart, you need to sign that front page as well. So your name, your initials, your signature, and your base where it says you're working in your scenario. Very important not to forget that. And then you're going to finish your station. So check the patient is comfortable, doesn't need anything. Again, ensure they have the call bell, know how to press it when they need assistance. Again, finish off your station with your final hand hygiene. And if you've got any time left, go back and double check that medication record. Make sure you have done all your documentation correctly. So my top tips for the station is, obviously it's a medication, so don't forget your ID checks and allergy checks. Read that full prescription, including the date, time, drug, dose, route, prescriber's name and signature. Confirm the prescription is clear, valid and legible. Verbalise the saline flush and your expiry date, and cross-check this against your prescription chart. Check and verbalise the sterility of your equipment and the packaging is intact. Verbalise and assess for signs of phlebitis. So you're verbalising and assessing for pain, erythema, edema, swelling, palpable venous cord or pyrexia. Don't forget to clean your needle-free cap for 30 seconds and allow it for dry 30 seconds. And do not place that needle-free cap down after cleaning. Keep hold of it in your hand. Get your saline out of your packaging, remove the top and then connect it, making sure you do not touch the key parts, your connector, hub or the end of your syringe. Flush your cannula using a pulsating action. Check in that the patient is not in any pain or discomfort whilst you do that, and then complete your documentation on the medication chart and the front page if applicable. Hope you found that video helpful. Again, I am doing OSCE tutoring, so if you need some additional help and support with your OSCE training, so I can do a full package of OSCE training going through all the scenarios and clinical skills. Or maybe you're practicing at home and just want to have an opportunity to practice your station in front of somebody and get feedback. I can do that as well. You may just want to book in for 1 or 2 sessions. That's absolutely fine. I can be relatively flexible and work within your budgets where I can. So I've got lots of teaching resources as well. Again, you could just contact me and purchase resources off me. So I've got API scenarios, mock OSCEs, professional values, evidence-based scenarios as well. And you can contact me via email, so hannah@outlook.com, or you can visit my social pages, Nurse Tutor, Tutoring with Hannah.